One start.
Hi, so good afternoon. My name is Ankit, and I'm working in Felix Hospital as an assistant manager training since last 1 year. And today we are here to get to know two of our most hardworking RMO doctors named Dr. Sheetal and Dr. Adil. So Dr. Sheetal has been working with us since last 6 years and Dr. Adil since last 1.5 years. Right. So on this auspicious occasion of Doctors' Day, we will be knowing them and about some of their memorable life experiences with some witty questions. Right. So yes. So welcome, doctors. Welcome,
Thank you so
welcome in
much.
this session, sir,
Thank you so
ma'am. Right. So we will start with Dr. Adil first. Right.
Sure.
Yes. So Dr. Adil, the first question is for you. If you could have dinner with any famous medical figure, living or dead, who would it be and why?
Okay.
Yes.
Thank you so much for inviting me, first of all, and
Yes, sir.
happy Doctors' Day. To all of the hardworking doctors, well, the question is very good. The question was that with whom I want to have the famous personalities.
Right, sir. Right.
So it would be Alexander Fleming.
Okay.
The reason being that the invention of the antibiotics by him, he was a very famous microbiologist. And why it would be because before the antibiotics, it was very hard. 90% of the children basically used to die because of a small disease, like for example meningitis.
Correct.
So 90%
Right.
of the babies used to die. But after the invention of penicillin, of course, this trend became, many of the babies were saved. So I adore him a lot. And if he would be alive this time, of course, I would have.
Perfect. An amazing answer. Thank you so much, Dr. Adil. Thank you so much. Next, let's come to Dr. Sheetal. So, doctor, what's the funniest thing a patient has ever said to you?
Oh my God. Let me go back.
Yes.
During the gynae OPDs, मुझे अभी भी याद है कि OPD कंसल्टेशंस के बाद मोस्ट ऑफ द टाइम जो हस्बैंड्स होते थे किसी भी फीमेल के, तो उस टाइम पे वो बहुत ही एक्टिव होते थे. मैम क्या खाना है, क्या देना है, क्या नहीं. सो वो पूरी लिस्ट लेके जाते थे. और उसमें जब मैं स्पेशली लिखती थी कि हाँ इनको अभी फ्लूइड्स वगैरह बढ़ाइए, जूस वगैरह दीजिए, तो जो सबसे ज़्यादा फनीस्ट मुझे लगता था वो ऐसा पूछते थे कि मैम जूस कौन सा. उनका कोई भी जूस चलेगा, बस ये फ्रूट्स अलाउड नहीं है, बाकी सब कुछ आप ले सकते हैं. फ्रेश जूस ज़्यादातर. मैम बाहर का जूस पैक्ड या एकदम फ्रेश जो घर में लेते हैं, कि सर कुछ भी फ्रेश या कुछ. मैंने कहा मैम अगर पैक्ड वाला लेंगे तो रियल और ट्रॉपिकोना, दिस इज योर चॉइस, आई एम एक्सट्रीमली सॉरी फॉर दैट. तो ये बड़ा फनीस्ट मुझे लगता था कि वो पूरा ब्रांड पूछते थे और उस टाइम अपनी वाइफ के साथ कि हम कितने ज़्यादा आपके लिए
राइट.
मतलब वो कनेक्टेड है कि भाई मेरी वाइफ को क्या खाना है, क्या नहीं खाना है. और स्पेशली मुझे जूस में बताइए कि मुझे कौन सा ब्रांड लेना है.
So, I guess some things never change. I believe these type of thing may exist today as well, no?
Yes.
है ना? In terms of
Definitely.
care towards the wife and towards the partner. This is something.
Dr. Adil is a very caring husband.
That's great.
Well,
So that's a
maybe-
great tip of advice that everyone should be like
Yeah,
the same
exactly.
concerned partners, right?
Maybe
Great.
that
Thank you
time-
so much. हाँ.
That time, the Dr. Sheetal is saying about this. Usually, that time the husbands are more excited. And
Right.
basically, their brains are not working than what they should. They're so excited. They're so careful that our baby should be safe.
Correct.
Juice. They cannot, they have to say everything to the doctor. For them, doctor is like a god that time.
Yes.
Because that is some type of
Yeah.
happiness which they must be experiencing for the first time in their
Exactly.
lives, no?
Exactly.
That's why. Great. So that's a fabulous answer, Dr. Sheetal. Thank you so much. Okay, so next, Dr. Adil, it's coming to you. If you could instantly become an expert in any other medical specialty, which one would it be and why, sir?
Oh my
Oh.
God. I know the answer. Dr. Adil.
Let me speak.
Yes, sir.
Yeah, of course, that would be robotic surgery.
Okay.
Because robotic surgery this time is the latest technology, and it has given the patients much comfort
Right.
and also the results.
Okay.
So why robotic surgery? Because I have seen in my medical practice which traditional ways we use till now.
Right.
Let's talk about, for example, a patient with prostatomegaly.
Right.
So he has developed a prostatomegaly, and then it developed into a CA prostate. So he has to undergo a surgery of prostatectomy.
Correct.
So usually the traditional way which we use this time is TURP, and it's like a little bit painful. Not little bit, it is painful, and patient has to undergo so much, mental stress because of that. But yes, robotic surgery has advanced, and we can do robotic surgery. The thing is that with the robotic surgery, it is precise. It's more precise.
In comparison to
Yeah,
traditional ones.
it's more precise, less painful, and it's accurate.
That's great.
So that helps a patient a lot in
That's
terms
great.
of his mental. He thinks that whether my surgery is done perfectly or not. So I would choose that, and I hope that I'll become a robotic surgeon.
That's great. That's great. Louds of applause to your choice.
Thank you so
Nice,
much.
good one.
Thank you so much.
Okay. Thank you so much, doctor. So let's come back to Dr. Sheetal once again for the different. This one is going to be a different one. So, Dr. Sheetal, if your life had a theme song every time you entered your clinic, let's imagine. So, which song would it be?
Oh my God.
I don't know about that.
Yes, ma'am. Please go ahead.
It would be तूने मेरे जाना कभी नहीं जाना इश्क मेरा दर्द मेरा हाय. That's it.
Perfect. Sounds good. And ma'am, reason of selection for this song?
It's for तूने मेरे जाना. Like my jaan is like Felix Hospital, where I am from last 6 years.
Yes.
That's great.
इश्क मेरा is the passion
Perfect.
जो मैं यहाँ काम कर रही हूँ, and दर्द is my family जिन्हें मैं पीछे छोड़ के आती हूँ.
Everyone
It's for just for entertainment. I
That's
think
great. That's great. Perfect. Thank you so much, ma'am. Thank you so much. Okay. Next, let's come back to Dr. Adil. Yes. So, Dr. Adil, what's the most unusual remedy or treatment you have heard of that actually works?
Okay. Yeah. See, I remember that I was in a camp. I'll tell you the answer of that later on, but I want to share a joke with you before that. We had a camp in one of the places in Noida,
Okay.
from the Felix Hospital itself.
Okay.
So there was a patient,
Okay.
and he came, and we did his normal random blood sugar,
Right.
and it was 584.
Okay.
So it was very high. He was never on any hypoglycemics. He was never on any medication. So I told him कि आपका तो शुगर बहुत हाई है, तो आपको दवाई लेना बहुत ज़रूरी है, एंड द सेम टाइम आपको एंडोक्राइनोलॉजिस्ट के साथ कंसल्टेशन करना है.
Right.
And he smiled on my face and said, no need of medication, no need of any endocrinologist, I will eat garlic instead.
Garlic.
Yeah. So I was like, what? So this is one of the things. And yeah, about your question, that the remedies which usually work, I have seen in my practice that the patient who usually come during these seasonal flus,
Right.
so this cinnamon hot
Dalchini.
water, dalchini we call it,
Right.
that actually affects more than the medicine.
Okay.
So this is one thing which I have experienced.
So, as a doctor, you can also prefer that a person who is going through that.
Myself, I do that. They can easily works.
They can touch their medication and they can be rely on dalchini instead.
Yeah.
That's great.
Family we can.
We can.
Perfect.
Yeah.
Thank you so much for the most honest answer ever,
Thank
doctor.
you. Thank you
Highly
so much.
appreciated.
Thank you.
Okay. Next, let's move on to Dr. Sheetal again. Yes. So, doctor, what's the most interesting fact about the human body that you know, which you think that everyone should know?
Okay. Most interesting.
Correct.
Okay. Interesting fact of the human body. वैसे तो बहुत सारे हैं, but because ज़्यादा टाइम मैंने गायनी में काम किया है, तो आप जानते हैं जब एक डिलीवरी होती है, बच्चे का सर एक पेल्विक बोन से निकलना,
Okay.
हाउ इज इट पॉसिबल? हम क्या किसी को ये पता है कि उस टाइम पे जो हमारी स्कल बोन्स होती हैं वो ओवरलैप करती हैं, वो इतनी फ्लेक्सिबल हो जाती हैं कि जो बच्चे का हेड का डायामीटर है वो 1 to 2 सेंटीमीटर हमारा कम हो जाता है उस टाइम पीरियड पे। वो एक इंटरेस्टिंग हमारा ह्यूमन बॉडी है वो, कि ड्यूरिंग बर्थ वो क्या होता है, मोल्डिंग होती है, स्कल बोन जो है वो ओवरलैप करते हैं, फॉन्टेनेल्स हमारे होते हैं वो जो बहुत ही सॉफ्ट होते हैं, और आफ्टर 12 to 18 मंथ ऑफ डिलीवरी जो वो फॉन्टेनेल्स है वो एक फॉन्टेनेल पहले बंद हो जाता है, एंड आई थिंक सेकेंड वन 3 to 4 years के बाद। सो वो एक बड़ा ही इंटरेस्टिंग सा लगता है कि मतलब एक बच्चा जो जन्म ले रहा है वही बोन आपकी एक जो डायामीटर है वो बिल्कुल कम हो जाता है और नेचुरली एक पेल्विक बोन से बाहर आता है। बड़ा इंटरेस्टिंग लगा मुझे ये।
That's quite a magical insight, I would say, doctor. Thank you so much. Even I was not aware of this detail. This is quite interesting how a natural human body works. Huh? At the time of birth, as you said, it automatically gets reduced. That is quite magical. God's logic. That's great.
Exactly.
Great. Thanks for the response, doctor. Next, let's come back to Dr. Adil again. Yes. So, doctor, so this is somewhat funny. What's your go-to joke or funny story to share with colleagues during a tough day?
Okay, so usually a tough day also has so many jokes and so many funny incidents,
Right.
which I always encountered. So again, this is a case with one of the patients. I was actually on a consultation, on a teleconsultation with him, and this patient was having, I think his father was having piles.
Right.
And I just normally answered, questioned him about his family and about his age of his father and all that. So I told him, so what's your name? He said, my name is Vikas. And I told him, just give me your information about your father.
Right.
After he explained all his symptoms and all.
Right.
He said, मेरा नाम विकास है और मेरे father का नाम पापा है.
Okay.
So I was for 2 minutes in shock that what is he saying?
Okay. Nice.
So this is one of the jokes which I encountered.
And usually love to share.
Yeah, another one I just remember that again I had this teleconsultation and somebody called me and he's like so much angry and ferocious and he's telling that, are you from Felix Hospital? I want a gas cylinder. Please tell me the rate of gas cylinder. So I just ignored the call. What to do?
That's great. That's great.
Yeah, these are some of the
I think
things.
he was waiting for oxygen cylinder and
No, he was not. He was not. Actually, he said gas cylinder HP ka. So that's what I'm saying. First of all, I thought maybe it's oxygen cylinder, but
Well, I would say those responses were the most funniest and wittiest among all
So much.
which we have heard.
Yeah.
For the last segment, let's come back to Dr. Sheetal once again. So, doctor, this one is related to the diet, I would say. Right? If you could only eat one type of food for the rest of your life and it had no effect on your health, what would it be? So,
oh my god, very simple. Tandoori chicken. Nothing else. I would like to have tandoori chicken daily, yaar. It's high protein diet. I can have it daily. No issues.
and have no adverse effects on the same time. Perfect. Sounds good. So, Dr. Sheetal, why tandoori chicken? Is there any particular reason?
I like it.
Just like it. Okay. So, guys, since we have known that her favorite dish is tandoori chicken, and not hers, I would say, it's universal favorite, right? And everyone wants to just have this non-veg type of diet and without adverse effect, I would say. So, again, an honest answer. Thank you so much.
I'll be planning tandoori chicken coming week.
Right. Absolutely. We are absolutely. We will be. Yeah. So, guys, thank you so much for joining in on this fun session on Doctor's Day, and we will be including or arranging these types of session again in these type of whenever these type of events will be there, right? And meanwhile, I wish Happy Doctor's Day to all the doctors who are tirelessly working day and night to save the lives, right? Without seeing their personal, profession, everything. They're just working, right? So let's hope and pray they continuously work towards the humanity, and let's respect them and just hope to be healthy and happy with them. Happy Doctors Day, everyone. Take care. Have a good day. Thank you.
Thank you. Thank you.